from the WHO, the Global Fund, the Ghana Health Service. This is the terminal report of the emergency system you are running. What are you going to do differently? Have the journalists done that? Do Ghanaians even know reports like this exist? Do they know how dire the situation is when they read reports like? And for me, Kojo, that is the bigger question.
Yeah. Okay, Dr. Ansong, Ansong Bridjan, a couple of things. First of all, could you help us with the average ambulance response time for Ghana?
Thank you very much. Currently, our average response time is 22 minutes.
22 minutes.
We do know that, as we've already established, that we have one ambulance per a district. And if the ambulance moves for a case within the district, some district places you will have to travel about 50 to 100 kilometers to reach your destination or where you are going to pick the patient. We also do know that the scarcity of the ambulances also makes it difficult to improve on our response time as they're looking for. But there are other factors, including the road network and also the congestion on our roads, all contributes to the response time. And so as we speak now, we are looking at 22 minutes. Some places they can make it within 5 minutes, 10 minutes, depending on the location of the incident.
Right.
But other places that you have to travel longer time because of where the case is found.
Now, Doc, I'm sure you heard our callers and a few of the messages we read. This recurring problem of ambulance service asking for fewer money. What's the situation with that? Why are we still facing that problem?
Let me emphasize here that when it comes to emergencies, there's road traffic crash and ambulance is called. Nobody requests for any fuel to respond to such an emergency because we are always making sure that the ambulance has fuel to respond to such emergencies. If there's somebody at home, a pregnant woman in labor with complications and the ambulance is called, nobody asks for any money from such a person. So as far as our emergencies are concerned, we don't actually ask anybody to pay any money upfront before the ambulance moves, because we make sure that at least there is fuel in the ambulance to respond to such cases. The only time fuel is demanded is when you have to transport patients with over long distances from a health facility to another health facility. And we all do know that sometimes a patient is moved all the way from, let's say, Tamale to Konfanochi, a distance of over 400 or 500 kilometers. So if you are doing such a journey in and out, and whatever amount of fuel that is given to that ambulance, even if it is full tank, it may not be able to move such a case from that distance and back to base. And so we make provision that such cases which are from health facility to another health facility, the relatives or the patient relatives must support the ambulance service to be able to move for that long distances. But internally running cases, those ones are done free of charge. It is only when we have to move patients for that long distance. And as we even speak now, government is making provision through the National Petroleum Authority to find means of providing us with additional fuel through the National Security Services fuel system, whereby government will provide additional fuel to enable us to move cases. But as I said, there are long distance cases that we cannot do anything about it, that patients or patient relatives must support us to be able to transport patients along that kind of distances.
I want to read you a message someone sent me, okay? It says, some years ago, my younger sister was involved in an accident. She hit a drunk pedestrian. She drove the victim herself to the 37 military hospital. I was called from the office. I got there, and after 5 hours of examinations and x-rays, it emerged that he needed to be transferred from 37 to Kolebu or Ridge. I made contact with the doctor at Ridge and shared the x-ray shots with him. He said to bring the patient immediately. So we needed an ambulance to transport him. The ambulance was right there. First, they said they did not know the whereabouts of the driver, so he had just come. Sorry, I just lost it here. Whereabouts of the driver, as he had just come in with another case. Kojo, for 2 hours we were waiting. When he finally showed up, he said he needed clearance from their boss before he would move. By this time, the doctor at Ridge had called twice, saying it was critical for the patient to be brought in, and they couldn't dispatch an ambulance either. Long story short, the patient was sent to Ridge after 4 hours of waiting, right by the ambulance. Upon arrival at Ridge, he was sent straight to theatre. Doctors said the patient suffered a brain damage as a result of the delay. The 32-year-old man is now confined to a wheelchair, has lost his speech, and needs total care. My family has had to support him from that time till now, thanks to a failed system. What do you say to this, Dr. Ansong, Bridjan?
Well, I think there are exceptions that sometimes there are some challenges here and there. And I cannot actually attribute it to the failure of the National Ambulance Service in responding to such a call. Because we also do know that sometimes if you, not that they want clearance, but the whole issue is that when sometimes you are referring a case and you don't get the receiving facility to confirm, you end up moving around so many hospitals because you get there and they say the facility is not ready, bed is not available, and those kind of things. So they always want to be sure that the facility has confirmed the readiness to receive the patient. And this particular one that you are talking about may be an exceptional issue because we don't have the facts to actually prove what the man is saying, whether it is truly what happened.
But it is a report from... It is a report from your...
for over 2 hours without responding to a call.
Yeah, Dr. Ansong Bridjan, it is a report from your customer, your client. They are saying that due to delays caused by your ambulance driver, they waited 4 hours standing next to the ambulance, just waiting to be transported. If it takes 4 hours to determine whether an order to move an ambulance is confirmed or not, then clearly there's a problem with your system, isn't there?
That's what I'm saying. This particular case, I cannot confirm as exactly what happened. Because if the ambulance was at the health facility, it would be strange to say that for 4 hours the driver could not be found. So we need to actually investigate to find exactly what happened. Well, this is the person's word that he is saying we weren't there, and it will be difficult for us to prove this. Because I cannot understand how an ambulance will be in a health facility to drop a patient there, and the driver of the ambulance cannot be found for over 4 hours. It is something that it cannot be possible.
Okay.
And since we don't have the facts from our end, it will be difficult for us to actually confirm or deny this particular case.
Okay. Now, Dr. Ansong Bridjan, you've talked about how 85% of the 300 ambulances are working. You've talked about how you've acquired an additional 26 or so. In your plan as the National Ambulance Service, how many ambulances do you believe a country like Ghana needs to be effective?
Thank you very much for this question. You do know that WHO standard, every 50,000 population needs one ambulance, at least, or at most 50,000. And so if we are talking about over 30 million population, then we are talking about not less than 650 ambulances.
Okay.
Within the population that we have now. So we need not less than about 650 ambulances across the country.
And in the absence of which you cannot perform effectively.
Pardon? I didn't get the question.
In the absence of the at least 650, you cannot function effectively.
What it means is that for us to be able to reach the ultimate, where our response time can be improved within the acceptable national standard of between 5 and 10 minutes, then in that case, we need to ensure that there are more ambulances stationed at various locations. We have to move to the sub-district level and even to other towns within the district. So if you have enough ambulances, then we can say that we'll be able to improve on our response time. And so to be able to function as expected, then it means the number of ambulances will need to be improved so that we will be at the various locations, be able to respond on time. And what currently we have done to even improve what we have is that the major highways, we have been able to establish ambulance stations along the major road highways so that in case of any road traffic crashes, they can respond on time. So if you take from, we have in almost all the major towns along the line, right from here, Achimota, Amasaman, Nsawam, Asuboy, Suhum. Then we move on to Bunsu Junction, then to Enyinam, to Nkoko, Jaso, all the way to Kumasi. That is how we have located the ambulances, so that in case of major concerns and also a public health concern, we'll be able to respond appropriately and on